To all of our faculty, staff, and students, I'd like to say thank you for all you're doing to serve our community and each other. This is an unusual time, and the situation with coronavirus is changing by the minute. I'd like to make sure you know what's going on and what we're doing to prepare. First, why are we working so hard to mitigate the spread of coronavirus? As we're seeing in China and Italy, when the virus goes unchecked, it overwhelms systems. That's why we're making difficult decisions now to better control the spread of the virus later. While most people who contract the virus will experience mild symptoms, we owe it to the most vulnerable in our community to protect them. Let's take a look at what's going on right now. Now let's look at COVID-19, where as of today, March 10th, 115,000 individuals worldwide have been found to have coronavirus. Right now, the mortality rate appears to be between 1% and 3%. Earlier on in the endemics, the rate was a little bit higher. More recently, the rate has been approaching 1% as healthcare professionals around the world get better at caring for this disease. Again, when we keep this 1% to 3% mortality rate in mind, there are many things that we deal with in clinical medicine where if we told patients they had a 98, 99% chance of doing perfectly fine, that would be encouraging. So while the mortality rate is quite a bit higher than seasonal flu, it is relatively small compared to a lot of things that we deal with at the academic medical center. Why all the focus on COVID-19 at the moment? And it has to do with the rate at which these infections arise in our community. These two curves show the difference between seasonal flu, for example, which comes on very slowly over many months, rises to a level where many individuals do get sick and some will pass away, and then over many months dissipates from our communities, typically in the spring. Some of the reasons for that is the flu's been around before. Many of us have immunity in our systems. Many of us take vaccines to prevent the flu, and we do have antivirals like Tamiflu, which helps keep flu in check. Coronavirus is a new pathogen to human beings, so we do not have immunity, we do not have vaccines, and we do not have antivirals that are known to impact diseases caused by COVID-19. And typical control measures include hand washing, teleworking, limiting large gatherings, and minimizing travel. So again, the goal is to help reshape the transmission of disease in our community from the tsunami to the slower, more steady, lower wave so that our healthcare system can take care of patients and not be overwhelmed. Probably one of the first things that you saw is in an effort to increase our capacity and to increase our ability to separate patients with respiratory illness from those with other illnesses. We assembled 3 large tents out behind the emergency room. These tents are areas where we can care for patients. They have controlled air systems, and we can help, one, add capacity to our emergency room, but also provide separation of patients who are experiencing respiratory illnesses. Please know we're prioritizing the safety and protection of our faculty, staff, and students. We're doing routine trainings and education to make sure everyone is aware of the most up-to-date information. We all need to work together. I'm confident in our ability to care for each other and to care for our community. The community looks to us during these challenging times, and I encourage all of you to do your best to stay safe and to stay healthy. Thank you.